Okay, so to begin the discussion on cardiovascular conditions, again, make sure that you're noting any signs and symptoms. I will point some out throughout this just to provide context, as I'll do with other instances, but still, have a pretty good awareness of all the different signs and symptoms. Any testing and then return to play is important for this. So make sure as you're doing your reading, you're making note of that in conjunction to what I'm talking about here. So to start out, to talk about sudden cardiac death. And sudden cardiac death isn't per se a condition. It's obviously going to be caused by different types of conditions, but it's a separate issue, and particular to what athletic trainers dealing with active individuals, this becomes important in order to manage cardiovascular emergencies in the field. So again, the prevalence I have up there. So it's very rare in young women. It's more common in young men. The thing that you typically have in a younger individual when you have sudden cardiac death, it's typically going to be caused by some type of congenital cardiac disease. So a lot of the conditions that we're going to be talking about are conditions that can contribute to sudden cardiac death. So I have up here as a thought question, what are some of the other causes? So in your text it lists some of the conditions, some of them that we're going to be talking about are conditions that can contribute to sudden cardiac death. So kind of make note of that in your reading on this section, in addition to when I go and discuss those other conditions in this video. Commotio cordis is when you have a sudden blow to the chest wall, and this is a cause of sudden cardiac death, and many times this happens in young individuals. And essentially what happens here is that during a certain part of the electrical impulse, so we had talked about, or by now we would have talked about in class, about the electrical activity of the heart. There's a certain point in the electrical activity of the heart that if there's a trauma to the chest wall, it can actually interrupt the electrical impulse. So that could cause a potential rhythmic disturbance in the heart that could cause cardiac death. If the cardiac rhythm doesn't get normalized promptly, has to happen pretty quick, so there has to be a defibrillation in a prompt manner, the individual does typically die from this. And this is obviously something that is much more common in sports where there's projectiles. So any sport where there's a ball, puck, where it's coming through the air and could possibly hit somebody, that's where you'll see this occur. So here's an illustration of of what it looks like. So obviously a blow to the chest, and where it's showing you, if you look down there on the EKG, it's showing you it's at about the upstroke of the T wave where you have this to where you can have problems with the electrical activity. And you see it's a very short window. Okay, it's showing you in the picture it's 20 milliseconds. So it's a very short window of time where you actually can have this happen. So it's rare, but it's something that can happen, and you got to be prepared for. So it's really important, particularly with younger individuals. If you're watching a sport where there's a projectile, this has to be something that is kind of in the back of your mind when managing it, because again, if the disturbance in the activity of the heart happens, it needs to be normalized pretty quickly in order to save the individual. Okay, hypertrophic cardiomyopathy. So this is the leading cause of sudden cardiac death. So again, as I started to talk discussing sudden cardiac death, again, very relevant to the typical younger active population. So the hypertrophic cardiomyopathy is the leading cause of sudden cardiac death in younger individuals. And what this is an abnormally hypertrophied but non-dilated left ventricle. So that's important. So we had talked about how exercise can cause hypertrophy at the heart, or an increase in the size of the heart muscle. Hypertrophic cardiomyopathy is an abnormally hypertrophied but non-dilated. So that basically means that the cavity of the left ventricle doesn't increase proportionally, but you have this thicker musculature on that side of the heart. Okay, so this is something that, and I have a picture of it on the next slide, and basically you end up getting, and this is a congenital thing, you could end up having the potential for sudden cardiac death, and this would be something that would very much limit a young individual's ability to participate. Very important in the physical to ask if there's a familial history of sudden death at a young age. So if an individual has a person who in their family died suddenly at a young age, there's the potential where this could exist, and you should probably look further into that. So here's a picture of a normal heart and then a heart with hypertrophic cardiomyopathy. So if you look at that, you look at the left ventricle in the heart, in the side where it is hypertrophic cardiomyopathy, you notice that the ventricle, the cavity is very small, and in addition to that, you have that enlarged heart muscle. So that produces a lot of issues, and as far as the ventricle's ability to fill with blood and how that would impact the circulation and the heartbeat. So that's the difference. Now, whereas with hypertrophy of the cardiac muscle that occurs with exercise, it's a much more even distribution of the hypertrophy in the heart muscle, and you don't have that smaller left ventricle size in the cavity where it fills with blood. So this is different than the normal cardiac hypertrophy that occurs as a result of being an active individual. This is an abnormal growth that isn't functional for the individual in order to participate in activity. Coronary artery abnormalities. So again, the coronary arteries are responsible for supplying the heart muscle with blood flow and then ergo supplying it with oxygen. So this is the second leading cause of sudden death in athletes. So any type of coronary artery abnormality could result in sudden cardiac death. Most events happen during or just after strenuous exercise. So from a timing perspective, that's typically what you look at. And again, this is going to be characterized, so there's different types. So again, this is a category of conditions, and there's some examples that I'm going to give on the next slide. But usually what you have is either an aberrant coronary artery or just complete absence of a coronary artery. So you either have a coronary artery that's not structured the way it should, so it's abnormal or there's a deviation, or a part of the coronary artery just isn't there. So obviously what this does is then that's going to interfere with the blood flow to the heart muscle. And again, this is comprised of a group of conditions, and there's some examples on the next slide that I'm going to give. So here are coronary artery abnormalities. There's both congenital and acquired. And then these are just some examples: myocardial bridging, atherosclerotic coronary artery disease, Kawasaki's disease, coronary artery vasospasm. So these are all different things that can potentially cause, or that would cause, an abnormality as far as blood flow to the heart is concerned. And then here's just a picture. So if you look at this picture here of coronary artery stenosis, so you see the abnormal travel of the coronary artery, and then that actually limits. So there's a dye going through that coronary artery, and you see how the dye sort of trails off towards the end. So that dye should be kind of evenly spread throughout, and it's not. And what that's showing is that there's kind of decreased blood flow through that coronary artery, which then obviously, during exercise, just even everyday life, you're not getting as much blood flow to the heart musculature, the myocardium, as you should be. Marfan syndrome is an inherited disorder. Now, Marfan syndrome, we talk about it here with the cardiovascular system because of one of its one of its main complications involves the cardiac system, but it's actually much broader than just the cardiovascular system. It's actually a connective tissue disorder. So what happens with Marfan syndrome is it's an abnormality in the structure of the individual's connective tissue that actually causes it to weaken. Now, where that's a problem with the cardiovascular system is it causes weakening of the vasculature, and one of the most common or more serious complications of Marfan syndrome as it relates to individuals is what's called aortic dissection and rupture. So the aorta, which is one of the big major artery in the body, ends up rupturing, and that's what accounts for a lot of the sudden deaths in individuals that have Marfan syndrome. So in a lot of younger individuals that have Marfan syndrome, when they incur sudden cardiac death, that's what happens. Now again, there are other complications associated with Marfan syndrome because again it affects other body systems, but this is primarily what we deal with in as far as the cardiovascular system is concerned. There's a table in your textbook that looks at some of the other diagnostic criteria, and it shows you in there how it affects the other systems of the body. So it shows what the musculoskeletal, as far as the eye, there's issues with the eye, the ocular system, and then the skin and integument as well. So take a look at that table 8.2 in your textbook. So here, when we look at Marfan syndrome, some of the common characteristics that you see, the thing that tends to jump out the most, as you see this with individuals, is that they have a very tall, thin physical structure to their body. So if you look at the individual in the picture, going along with some of the diagnostic criteria, an arm span longer than your height. So they say an arm span to height ratio greater than 1.05. So basically when you put your arms out to the side, as the individual is in the picture, that's basically from fingertip to fingertip, he's longer there than he is tall. Okay, and that just goes to show you how long the limbs are. Some other things that you see with this, the pectus excavatum, which we had talked about in the previous chapter in the respiratory system. So you have that kind of divot, okay, in the chest wall, which again doesn't have to be indicative by itself of a condition, but when you look at some of these other things tied in, it's kind of another piece that shows that this could potentially be an issue. The arachnodactyly, if you look on there, that's basically the very long fingers. One of the diagnostic criteria is what's called a positive wrist sign, okay, where the thumb and the index finger overlap when you put it around your wrist. So the person takes their thumb and index finger, wraps it around their wrist, and the thumb and the index finger overlap, which would happen in somebody with these very long fingers. That would be something that would again indicate or be an additional thing going towards someone having Marfan syndrome. And the picture all the way in the lower portion there, the dilation, is just kind of showing you where the aorta dilates. Okay, so the diameter of the aorta increases, and then obviously that's where the blood flow is leaving to the heart to go to the rest of the body. If that tissue's weakened and ends up rupturing, that's where the issue with sudden death would occur with Marfan syndrome. So another complication associated with Marfan syndrome, and this is actually a condition that could actually occur by itself, and we're going to discuss it later on as well as an individual condition, but this is another complication of Marfan syndrome, is a mitral valve prolapse and regurgitation. So what happens with a mitral valve prolapse, and we had talked about the anatomy of the heart before and kind of how the blood flows. So the mitral valve is when the blood goes from the left atrium to the left ventricle, the mitral valve kind of opens up, lets the blood flow in, and then it closes, so none of it goes back into the left atrium. In the case of a mitral valve prolapse, that doesn't happen. What happens, if you look on the picture illustrating the mitral valve prolapse and regurgitation, the valve kind of folds backwards, allowing blood flow to go back into the left atrium from the left ventricle. So it kind of causes a little backflow with this. And as I had said, this could be a condition in and of itself that could be monitored, but with it could be another further complication associated with Marfan syndrome.